Hi there, Dr. Tansavatdi here. Today we are performing under eye rejuvenation. I've had a couple of videos in the past just demonstrating this, but in the past I've used a needle, and I wanted to show the injection with a micro cannula, which is, if you see very closely, there is a opening on the side there, and this cannula is a 25 gauge cannula. It's blunt on the end, it's a little rounded on the end. I don't know if you can just closely see that. Yeah, okay. So for some patients, this is going to be a little more uncomfortable. Not that it's painful, it's just a little more uncomfortable because with the needle, you think with a sharp needle, you're going to feel all of that. But actually with the cannula, because I'm sort of gliding it in the tissues themselves, there's more pressure. So it's not pain, but more pressure. Whereas with the needle, it's more sharp pain. And when we use numbing cream on the surface of the skin, then you don't really feel the needle as much. But with the cannula, you can't numb the deep tissue underneath. So patients will often say to me that it's a little more uncomfortable, but they're able to still deal with it. It's more uncomfortable in the lips, and with that, I would recommend doing a block before we do a cannula technique for the lips. This patient, our patient here, had Restylane lift before, 2 vials. She was very hollow in the cheek area and under the eye, and I always say the cheek supports the eyes. So we did 2 vials of Restylane lift. She's less hollow, but now she has just a little bit more hollowing that we just want to touch up. And so I'm using Restylane today instead of what we've used in the past, which was Restylane lift. So Restylane is a softer product than Restylane lift, and doesn't lift as much, but it provides some good volume in the under eye area. So before I start, I am going to actually ice the spot that I'm going to introduce the needle. And that was just to ice the skin so she doesn't feel that poke. Now, introduce the cannula in that same hole. There we go. And she's pretty comfortable, it seems, from this. You don't want to be too deep where you're deep to the muscle. With this technique, we're actually in the subcutaneous plane, but it's safe because it's not a sharp object, so we're not going to get into a blood vessel per se. And here we are, just injecting the product right under the area where she sees some puffiness. She's got some bags there, and I'm just going right underneath that bag area and just doing a little injection. Okay. And that's it. So this product is soft, so I'm molding it right now and just making sure that we get a smooth, even injection. Okay, so that helps me to see exactly where, and you can see that she's got a little bit of bag still showing here. So I'm going to try to highlight this spot and just go right underneath it, and that's where we're going to go with the filler, so that she doesn't see that. Okay, and that's it there. Go ahead and close your eyes. Now I'm going to use that same spot, and I'm going to inject along this orbital rim, which is also called the orbital malar groove in some patients if they have a very prominent malar mound, but for her, she doesn't have a prominent malar mound. Sometimes tricky because going through that same hole, it was in a different direction, so I'm going to see if she can tolerate this going right up to this area. And then we're going to inject here. Okay. So now you can see the difference between the 2 eyes. I'll have you take a look. Okay, so you could see I'm now wiping this side so you can see the difference. If she looks up, the subtle difference where it's this bag that she used to have is not as prominent, okay? And we also added a little bit there, okay? So just kind of evened out, softened the whole area under eye. So now we're going to work on this right side. So now we're doing this other side, the right side here. And again, I'm having you look up. You can see where her bags are, okay? And I'm going right underneath it. So you can see the cannula, and that's what I'm aiming for, is going under the bag. So there, there, okay? Okay, just a little bit will do. We don't need to overdo it. Tiny bit more. So it's very subtle what I'm doing. Okay, so I'm going to work on the outside here, the lateral orbital rim. This can sometimes be a little more sensitive for people too as I get close to that lateral canthus, which is out here, okay? There we go. So that is going to soften out that whole lateral cheek area where the eye starts to meet the lateral cheek. If you've got this depression here, it creates more of an aged appearance. So I've just lifted the cheeks a little bit so that it's a smooth transition. So you can see that on both sides, we've done that same thing. All right.